We start with the latest on the coronavirus situation in South Korea. Amid soaring cases, health authorities have announced the final details of their step-by-step recovery plan. For more on this and other COVID-19 related updates, joining us in the studio is our reporter Choi Min-jung. Good afternoon, Min-jung.
Good afternoon, Mok-yeon.
Now, Min-jung, the government has released the details of their new shift to COVID-19 scheme. Can you tell us the details about the first phase?
Right, so earlier the Prime Minister announced the finalized details of the scheme. So from November 1st, South Korea will begin its three-step transition back to normal life. All businesses, including restaurants and cafes, will now be able to operate 24 hours a day. But bars, clubs, and other nightlife entertainment facilities are excluded. Vaccine passes will also be required for people entering facilities deemed high risk, like bars, fitness centers, and singing rooms. Those who aren't vaccinated will need a negative PCR test taken 2 days before going to the venues. Some have made complaints that this measure is unfair as it is not required for entry into other facilities that may also be vulnerable to infections. But let's take a listen to what the Prime Minister had to say.
This decision was inevitable as it is needed to reduce the risk of infection fueled by the easing of restrictions. However, depending on the facility, a 1 or 2 week grace period will be provided to prevent on-site confusion.
Limits on social gatherings have been lifted as well. For social gatherings, a maximum of 10 people can meet in the capital region, and elsewhere, 12 people can gather regardless of vaccination status. However, groups at cafes and restaurants should contain no more than 4 unvaccinated members.
Now, Min-jung, alongside that, we're also expecting a more detailed approach for schools today, right?
Right, so in the coming hour, the Ministry of Education will announce plans on a gradual return to normalcy for schools. They are expected to expand school attendance for students in the capital area and discuss when to normalize classes involving group discussions and activities. Currently, only 2/3 of elementary and middle schoolers in the capital area can attend in-person classes, while there are no restrictions outside the region. Still, officials are being extra cautious with their decision as many younger students have not yet been vaccinated. That being said, infections have begun to increase as daily cases among teenagers set new highs this week.
So distancing measures have been eased and schools are working to get back to normal. But what about travel? Do we know anything about that?
Well, you're not going to have to wait for too long for more international travel. Starting next month, numerous international flights will once again become available. Korean Air will resume flights to Hawaii, Sydney, and Auckland, and Asiana Airlines will increase the number of flights to Bangkok from 3 times a week to every single day. The country also formed a travel bubble with Singapore earlier this month, and the flights will take off in November as well. Koreans who are fully vaccinated will be able to visit the country without quarantine.
No, that is some great news for many of us. Now, moving back to the local front, how are we faring in terms of infections today?
Right, South Korea reported 2,124 new cases today, surpassing the 2,000 mark for the second day in a row. Officials say the recent spike is mostly due to people becoming more complacent in regards to prevention measures, as limits on social gatherings were partially eased last Monday. Authorities remain on high alert as the country is witnessing a growing uptick right before the nation kicks off its Living with COVID scheme.
Yes, in fact, we're also hearing that many concerns have been raised over possibilities of a further uptick in cases after the restrictions have been eased, right?
Right, so health authorities and medical experts are saying that South Korea could see up to 20,000 cases a day once the country transitions to living with COVID-19. The Korea Medical Association says South Korea may have to face a 5th wave of the pandemic as restrictions are eased. They also added that the cold winter season is another cause for a potential spike. While acknowledging the need for a step-by-step recovery, experts emphasize that officials should focus on preventing a meltdown in the medical system as well. In case of such an emergency, or when more than 80% of hospital beds are occupied, officials say they will consider halting the restrictions temporarily to enforce an emergency plan.
All right, Min-jung, thank you so much for your report throughout the whole week. did a great job and hope you have a nice weekend.
Thank you.